So Lollapalooza follow-up. I know there is a lot of interest in this, and we are, as of today, 14 days post the beginning of Lollapalooza. And so in this setting, we wanted to share what we have seen. The bottom line is we've not seen anything that has surprised us related to this Lollapalooza outbreak. But let me talk you through what we've been doing to follow up, and then I'll share the data. So as a reminder, Chicago's case investigators continue to reach out to interview every Chicago resident who is diagnosed with COVID-19 to document their exposures, to conduct contact tracing, to match to vaccination records. So we investigate every case, always, not just related to Lala, and other public health departments do the same thing across the United States. We then share information if we're seeing exposures in out of jurisdiction, where something like Lollapalooza would be. We also developed a supplemental questionnaire for any cases that reported Lollapalooza attendance. We knew there would be a lot of interest in this, and generally where we have large events, we will do additional investigation. We put out a nationwide request for case reports from any other health department. We use standard secure public health communications channels for that, and supplemental interviews of anybody who reported any attendance at Lollapalooza are ongoing. We also work to follow emergency department data at Chicago's hospitals because we like emergency data. You can follow people who present with symptoms that could be COVID, even if they don't have a diagnosis, and it's a way to see, are we seeing any changes in what we call syndromic surveillance? We didn't see any changes in COVID-like illness patterns, and we also specifically every year for Lollapalooza, we actually have a tag if people come to the emergency department associated with this event, because every year we see people come to the emergency department for substance use issues or, heat problems or dehydration, and this year we expanded that for 2 weeks post Lollapalooza so that we could follow up any potential COVID. Did not see increases or additional cases coming in through the emergency department. We also followed Chicago's overall epidemiologic data. So, for example, I showed some of that age group and some of what we've been seeing in terms of Chicago breakdown. Have not seen anything different at the city level in terms of patterns that would suggest an impact from Lala. And then we obviously will continue to do further investigation as necessary, but I want to make sure everybody understands any person diagnosed with COVID-19 on or after attending Lollapalooza is included in the analysis. So these cases may or may not have resulted from transmission at Lala itself. We've been very broad here. Anybody who is potentially associated, we want to investigate. So we're not saying that every one of these folks was infected at Lala. In fact, we expect they were not, but we take a very broad view because we want to understand the whole picture. So now 14 days post, as I said, we've had no unexpected findings at this point. There's no evidence at this point of a super spreader event, and there's no evidence of substantial impact to Chicago's COVID epidemiology. We estimate approximately 385,000 people attended Lala. Approximately 90% plus were vaccinated based on measures that were taken at the site. We used 88% vaccinated as a conservative estimate for our calculations. So in total, we estimate that among vaccinated Lollapalooza attendees, 0.004% were diagnosed with COVID. That's 4 in 10,000 vaccinated attendees, or 127 attendees. Among unvaccinated attendees, we did, as expected, see a higher rate of COVID cases, but it was still low. Among unvaccinated Lollapalooza attendees, we estimate 0.0016%, or 16 in 10,000 attendees, 76 unvaccinated attendees reporting tested positive. And as of yesterday, we had no hospitalizations or deaths reported. We do continue to follow up. I had told my team before Lollapalooza that we were expecting to see in the vicinity of 200 cases, just based on what we knew about our case rates and the fact that people tend to assume that their COVID exposure is at a large event like Lollapalooza, even if they've had a lot of other exposures. And we have, in fact, seen this total of 203 cases identified with attendance at Lala and symptom onset on or after attendance. 58 Chicago residents, 138 non-Chicago Illinois residents, and 7 out-of-state residents. And just to highlight again, this is also reflective of risk in likely where folks are also coming from and going to, if you're seeing different rates among Chicago and non-Chicago attendees. So nothing unexpected in terms of these numbers. The majority of our positive attendees were non-Chicago residents, 71% 82% of them. The majority were under 30 years old, 79% of them. The majority were white, non-Latinx, 62% of them. And the majority had symptoms, 82% of them, although we did have some folks who were not symptomatic but were tested, and they are also included. Where we look at our Chicago cases, 58 of them at this point, really important to note, not just for Lala, but for everybody in Chicago, 13 of those cases, 22%, did report attending Lala on or after the day their symptoms began. This is a really important reminder. We need everybody in Chicago not to ignore symptoms, assume it's a summer cold, regardless of your vaccination status, because we know vaccines are not 100% protective. So we've been asking people to stay home and test. But, unfortunately, in this case, these are largely folks who were vaccinated and therefore assume they didn't have COVID. But we did have some folks attending with events, which is why we work to try to pair, if you think about other settings, symptom screening with vaccination. We also had 17% that specified other high-risk potential exposure locations during the time, including bars and out-of-state travel. We continue to do interviews for non-Chicago residents. Again, nothing unexpected here. No sign of a, quote, super spreader event, but clearly with hundreds of thousands of people attending Lollapalooza, we would expect to see some cases. This is the graph, just to give you a sense of when people were, who attended Lala were reporting having onset of symptoms, or if they didn't have symptoms, a positive test. July 29th through August 1st was the time of Lollapalooza. Blue represents Chicago residents, red represents non-Chicago residents. And so, not surprisingly, folks were attending Lollapalooza. We've not seen a lot of continued cases or late appearing cases coming after Lollapalooza, but we're continuing to do follow-up. Again, nothing really unexpected or out of the ordinary that we're seeing here. There was a survey of attendees that was also done, looking at, for example, were people getting vaccinated in part to attend Lala? We saw younger attendees were more likely to say that attending Lollapalooza was an incentive for them to be vaccinated, which goes along with what we've seen with our Protect Chicago music series. We know attending events like this can be a good incentive for vaccination. We also asked, did the requirement that attendees show proof of vaccination or a negative test make you feel safer at Lollapalooza? 76% said yes, 11% said no, 13% said it didn't matter. And we've been really pleased to see other large music festivals around the country following our lead here. Just yesterday, you may have seen, for example, Summerfest up in Milwaukee, Bonnaroo down in Tennessee. Both announced that they were going to require proof of vaccination or recent negative COVID test. Pitchfork, that's going to be here in Chicago, announcing the same. And I'll tell you, at the time that we were hosting Lala, these events were not planning to have any checking of vaccination or COVID testing, and that was not something we were comfortable doing here in Chicago. Felt strongly that if we're pulling folks together, this needed to be part of the event. Obviously, also an outdoor event, an event that largely attracts younger people. So I think having some additional data, knowing that it is driving vaccination rates for younger people, and that generally it does make people feel, at least some people, more likely to attend, I think is helping to drive what I think is a best practice in this space. So just as we look ahead, COVID risk cannot be eliminated. We want to stay open as a city, but staying open also means being careful. It means first and foremost getting vaccinated. It means getting tested if you have any COVID symptoms, and for now, wearing a mask in indoor public places. So please, now's the time to get vaccinated if you haven't had the chance yet. Vaccinating all age-eligible Chicago residents is absolutely the most important strategy to keep people out of the hospital, to save lives, and to get Chicago post-COVID. We are continuing our Protect Chicago music series, offering free tickets to concerts exclusively for vaccinated Chicagoans. We also are continuing with large events at this point. The Lollapalooza is not the only event that we have looked at, and we have consistently seen with outdoor events not signs of significant spread. We've also seen relatively high vaccination rates at this event, at events. And again, if folks are going to large events, please get vaccinated. It helps reduce the risk for everybody. To give you a sense, for example, last weekend at Market Days, we had our Protect Chicago vaccine ambassadors on site, just as they were doing at Lala, getting a sense and checking, what percentage of folks are vaccinated, COVID, seeing what's happening with testing. And we were seeing well over 95% vaccinated at that setting. And then there have been some of these events that have been providing some testing. There's interim results, small number, but we've been seeing really a minority of people, less than 2%, attending these events who test positive for SARS-CoV-2 or for COVID. So we continue to absolutely recommend that all festival and large event organizers require all attendees to be fully vaccinated against COVID or have a negative COVID test. We also are continuing to obviously recommend wearing the mask indoors right now, regardless of vaccination status, not forever, but while we get through this Delta surge. And if we do see numbers, if we do see one of those risk factors move into the higher risk category, we may move to do some more enforcement around that, but that's not right now.